I'm Sana Khan and you're watching Medicircle. Today we have a very interesting personality with us on our Doctor Speak. He is a cosmetic aesthetic plastic surgeon from Srinagar, Jammu and Kashmir, currently working at King Abdullah bin Abdulaziz University Hospital. He has experience in surgeries like body contouring, breast cosmetic rhinoplasty, liposuction, eyelid surgeries, and other plastic surgeries too. Please welcome Dr. Tawheed Ahmad to our show. Hi, Dr. Tawheed, how are you?
Alhamdulillah, I'm fine. Hi, Sana. Thanks for this nice introduction. And I am, as well as cosmetic, I am also doing the reconstructive surgeries, which are very common in the India as well,
Right,
and all sorts of plastic surgeries, I would say.
that's great, sir. What motivated you, or what was the moment you decided to pursue plastic and reconstructive surgery after your MBBS?
Yeah, this is an interesting question. I would like to answer it in the phases. Actually, I was not directly interested in plastic surgery because while you are doing your MBBS graduation in the medical school, you are not too much exposed to the plastic and reconstructive surgery because this is a subspecialty. You are mainly uh, exposed to the general surgery, which you usually get posted in between. So while I was doing my internship, after completion of MBBS, you have to do a mandatory 1 year internship course. While I was doing this 1 year internship course, we are being posted as a doctor in different specialties in medicine, surgery, gynae obs, and all sorts of these branches of medicine. And I found that surgery is very interesting as a field because it is a you need to have be on tip of the toes and you have to work 24/7. You have to be energetic and saving lives of the patients. For example, the trauma patient, you are rushed to the hospital, it needs a lot of adrenaline rush, and it gives us the immediate results as well. For example, the patient had appendicitis attack, and then you use it to just remove the appendix and the patient's life is saved. So that actually made me interested to opt for a surgical field. Then I went to the Sher Kashmir Institute of Medical Sciences, which is a tertiary care institute in Jammu and Kashmir, only tertiary care institute, I will say. And I did my MS, that is the master's degree in surgery in Sher Kashmir Institute of Medical Sciences. Then during these residency days, we have to rotate in all subspecialties. That's where I was the first of all, I was introduced to this plastic and reconstructive field. And I found this plastic and reconstructive field totally different than the other specialties. And because usually the plastic surgeons are not confined to the particular region. For example, if you have a cardiac vascular doctor, he will more confined to the heart
To the
and
heart.
chest. And if you have gastroenterologists, more to the abdomen.
Right.
So, but these plastic surgeons usually operate from head to toe, anywhere on the body. And one more thing in the plastic reconstructive surgery is that I found a lot of patient satisfaction because once you uh, some people have lost the nose and you make it, for example, a new nose. For example, the patient who doesn't have his ear, you make a new ear. You add the tissues, and so I found a lot of patient satisfaction in this field. That's why I opted a plastic reconstructive surgery as my field in the future. Then I did my doctorate MCH in plastic reconstructive surgery, and also did my board DNB and from the National Board of Examination of Delhi. And presently, I'm also having the fellow of American College of Surgeons.
The field you are in is always in the buzz with connection to celebrities or influencers opting for a certain plastic surgery and sort of that. Tell us, what are the risks associated with this procedure?
Yeah, actually, you're right in saying that there's a lot of buzz around the plastic and reconstructive surgery, but mainly the buzz is around the cosmetic part of it. The major part of it is the reconstructive part. Not much of the buzz is in that field. Only the thing is when you do the face transplant or somewhere in France and then also doing in the US these days. So you get a little bit of the media coverage. But yes, the cosmetic surgeries get a lot of buzz around. But I will say that no surgery in the world is immune to the complications. And the same is true with the plastic surgery. And the complications can be as minor as the small infection, or it may sometimes risk the life of the patient as well. But one thing good about these plastic surgeons are that we are called perfectionists. Usually, these plastic surgeons take utmost care to do the surgery as meticulously as possible and to have a least of the complications. But still, there can be a risk. But usually, the plastic surgery, as compared to the other surgical fields, has lesser risks and better outcome, I would say. Because one more thing is that, for example, we have a lot of patients in these surgeries. If another surgeon, for example, does in a 1 hour, we will do the same job in 3 hours, 4 hours, because we don't rush into the things. We do every job very meticulously. That is a good thing about the plastic surgery.
Okay. In the West, the outlook towards beautification surgeries is quite liberal as compared to in India, where people are constantly looking for non surgical procedures. What are the trends that are dominating the practice as a surgeon in India?
I would say yes. In West, you are having people who opt for cosmetic surgeries very eagerly, and it's very common there. And in India also, it is slowly and slowly picking up, especially in the metropolitan cities like Mumbai, Delhi, and Bangalore. And people actually are getting aware, masses are getting aware about these cosmetic surgeries through media and other resources, and they are a little bit going towards these things. But I will say yes, overall in India, the main part of the plastic surgery is reconstructive, and mostly the plastic surgeons are busy with the reconstructive part of it and less with the cosmetic one.
My last question would be, how do you see calm under pressure while embracing the new normal here on? Because COVID 19 is here to stay as a part of our normal life.
Yes, you are right. But the life must go on, as
Sure.
people and the hospitals as well, and we physicians as well are getting adapted to the new normal. And we are now starting, in fact, all hospitals across the globe are trying to start as before as they were before COVID situation. And but we have to take the utmost care to stop and to prevent the dissemination of this COVID virus. But
Right.
we have to now get adapted to this new normal, and it's going on as of now, slowly and slowly.
Sure. Okay, sir. Thank you so much for giving us your valuable time. And it was great talking to you, Dr. Tawheed, on our Medicircle platform. It was interesting to know
Thank
about the latest trends in plastic surgery.
Thanks a lot. It was really my pleasure to have the interview with this Medicircle, and we'll see in future as well. I will be continuously putting my inputs whenever you need me. Thank you.
Thank you
Thank you for
so much.
inviting me.
Thank you so much.